Good morning to you all. I'm Renee Francoeur with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and Dr. Catherine Elliott, the Acting Chief Medical Officer of Health. Closed captioning is provided by the National Closed Captioning. Thank you to Mary Teason for providing our ASL interpretation today. Following the remarks from our speakers, we will go to the media present in the room and then on the phone lines for a round of questions. I will call you by name and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I will now hand it over to Premier Sandy Silver.
Thanks, Renee. And thanks, everybody, for joining us today. We're here on the traditional territory of the Kwalindun First Nation and the Ta'an-Kwachin Council. It's very good to be here with our Medical Officer of Health, Dr. Catherine Elliott, for another COVID-19 update. And before I get started, I do want to wish all of the students and teachers and staff who are heading back to school in Dawson City and in Pelly Crossing this week, and best of luck for the year ahead. This time of year definitely brings back fond memories for myself, of the excitement, the stress, the anxiety of beginning a school year is always very palpable. I'm very confident that our K-12 school guidelines for 2021-22 and the lessons that we've all learned over the past year together with the guidance from the Chief Medical Office of Health will allow us to have a very successful school year. So also best wishes on a fruitful year to all the remaining Yukon staff, students, parents, and teachers as they head back to class next week. As you know, the territory is adapting to living with the risk of COVID, and this work is ongoing. We are currently at a better place than we were at earlier this summer, beginning of this summer. There have been no new outbreaks, and our situation is continuing to stabilize. Our thoughts are with our neighbors at this time, though, Alaska and also Fort Good Hope in the Northwest Territories, who are currently experiencing large numbers of active cases. We have 3 new cases here in the Yukon to report as of yesterday, all in rural Yukon, and the number of active cases is currently at 50, though that number may change today as cases and recoveries are confirmed. On Wednesday, we did report our first case of the Delta variant. There are currently 2 active cases of the Delta variant in Yukon. Both cases came from outside the territory. One person is self-isolating and recovering well at home, and one person is in hospital. All contacts are self-isolating as well. There are no exposure events within the Yukon associated with these cases. While this is serious news, we must remember that we are very well prepared for this reality. Delta has been in Canada for a while now, and we know what to do, and we've been well prepared by the Chief Medical Office. We know that the key to keeping our communities safe is to get tested if we have symptoms, to continue to wear our masks in crowded places where physical distancing is not possible, and to get vaccinated. To date, the science shows vaccination is effective against known variants like Delta. If you are actively choosing to not get vaccinated, you are leaving yourself and those around you at risk of getting COVID-19. Immunization remains a very powerful tool that allows us to treat COVID-19 as a largely preventable disease at this point. This has also been communicated clearly in the personal stories that many Yukoners have bravely shared about why they chose to get vaccinated. So please, if you have not already booked your shots, you can do so. You can make appointments online at yukon.ca/this is our shot. I want to thank each and every Yukoner who has stepped up and received their 2 jabs. It's because of you that more than 80% of eligible Yukoners over the age of 12 are now fully vaccinated. That's incredible. We continue to lead the country in vaccination rates. This is a really good position to be in as we shift our approach and move towards the next phase of living with COVID-19 risk. Our government has been actively planning our next steps to help all Yukoners to adapt as needed as the state of emergency wanes. Today, we're very proud to be releasing the new document here, which is Forging Ahead, the Yukon's continuing response to COVID-19. This document, guided by the advice from the Chief Medical Office of Health, will pilot the way forward as the Yukon readjusts to living with COVID-19. Our top priority is still protecting the health and safety of Yukoners. Following the end of the state of emergency on August the 25th, Forging Ahead helps us see that we have other more flexible tools to utilize for living with COVID-19. These tools allow us to mitigate the risk of the virus and maximize the overall health and well-being of all Yukoners. Forging Ahead contains, as discussed in previous updates, 6 pillars that will guide how we prepare and respond to future surges and inform our ongoing response. For example, pillar number 1 centers on First Nations and community partnerships. Our partnerships and committed collaboration have made all the difference in managing the virus across the territory. Working together makes us stronger, and we will ensure close government-to-government communications with First Nations and municipal communities will continue. The other pillars are vaccination, testing and surveillance, surge capacity, social supports for vulnerable people, and public health measures. The document is available now on yukon.ca. You can read more about each of those pillars there. Forging Ahead also highlights 2 overarching goals: protecting our vulnerable populations and enhancing Yukon's well-being. We cannot overlook that COVID-19 has unequal impacts on different segments of the population, including women, young children, those with precarious or insecure housing. We cannot move forward without keeping all of this in mind. We shaped Forging Ahead with the knowledge that social connection, physical and mental health, and economic vitality are fundamental to how we need to move on with our recovery and beyond. With these goals guiding Forging Ahead, our government can continue to put people first by acting on more targeted measures and providing flexible supports to protect all Yukoners from COVID-19, while also minimizing the impact of restrictive, broad public health controls. We are following the science of public health. We are actively monitoring the situation here and in other jurisdictions as well. If the risk changes, we will adapt, as we have in the past, as necessary. This is still about responding to Yukoners' needs. Now, before I hand things off to Dr. Elliott, I do want to remind Yukoners, as I noted earlier, that the risks associated with COVID-19 have changed with the availability of vaccines. I think it bears repeating that this is now a largely preventable disease. Generally, our total numbers of active cases continues to decrease. As such, we are moving away from the need for regular updates from our public health officials. That being said, our government is open and transparent, and we will continue to report our numbers and provide updates online at yukon.ca. You can always check there for the most up-to-date information. We are in a very fortunate position, thanks to the diligence of Yukoners like yourselves and the amazing public servants, healthcare professionals, communication specialists that have delivered critical programming, services, and information, and including those immunizations as well throughout the course of the pandemic. Thank you to you all. We need to keep it up. With a new and evolving direction, with new tools and protocols, we will absolutely forge ahead together. Thank you very much, everybody. Dr. Elliott.
Thank you, Premier Silver. Good morning. Bonjour. I would also like to acknowledge that I'm speaking today from the traditional territory of the Kwanlin Dun First Nation and the Ta'an Gwach'an Council. As we take the next step on the path today, a critical step that'll move us out of the pandemic response toward living with endemic COVID-19, I want to firstly briefly acknowledge where we have been. We have walked a road together over the past 17 months of this pandemic, from the unfortunate but wise canceling of the Arctic Winter Games through a couple of clusters and smaller outbreaks. In June, we faced our biggest surge to date, and now we see the case counts are stabilizing. We are now and will continue to respond as we move forward toward living with COVID. I'm so very grateful for the strength and the resilience of Yukoners during this period. For those who have found creative ways to keep to the public health guidance while running businesses, recreation centers, transportation and government offices, media, and of course, schools. I am so very grateful for the teachers, the students, and the staff for what they did last year to keep our schools open when many, many jurisdictions had to close their schools and to run them safely. And I am so much looking forward to the schools opening and running safely this year. I am grateful for the sacrifices so many of you, not the least of which are those who are working throughout the healthcare system, the vaccine team, the staff at YCDC, the laboratories, and those throughout Yukon hospitals and healthcare centers, medical clinics, emergency medical services, and all those who have worked alongside and supported them, and to their families and loved ones for the sacrifices that they have made in order that their family members can do this work. Today, I will talk about the current COVID-19 situation, explain some of the important elements of the next phase of our response as outlined in Forging Ahead, and of course, answer your questions. Let me start with a case update. On Wednesday, we announced that the Delta variant has been detected within the territory. We announced 2 infections that were acquired outside of the territory, and that 2 people were recovering, 1 in hospital and 1 in isolation. All of the contacts of these people have been identified, and they are following YCDC advice. I would not be surprised if we have 1 or more positive contacts in the coming days, and I want you to recognize that these people have been isolating and the transmission risk is not present. As of the end of yesterday, there were 50 active cases of COVID-19 in the territory, and 616 people have recovered from COVID since this wave began. Unfortunately, 6 Yukoners have died since June 1st, and 8 overall since the beginning of this pandemic. We are also working closely with Ross River, and a rapid response team has been on the ground since Wednesday, and vaccination programs have been augmented. All of this events that we've had over the past couple of months can show us that we continue to have some small amount of COVID-19 spread amongst people who are not yet vaccinated. The rate of spread has declined and the numbers remain stable now. The vaccine has protected us from a much higher case count and even more people with severe illness, and unfortunately, more people could have passed away this summer. It is our vaccine rates that have kept us protected during this period. We were among the first populations, one of the first populations in Canada to have a surge despite a large proportion of the population vaccinated. Now other parts of Canada are themselves experiencing surges of cases among those who are not yet vaccinated. Nonetheless, the amount of transmission and severe illness and death, even for those who are infected, is lower due to the overall vaccination rates. All of this shows us that the vaccine works, and I'm asking again all eligible Yukoners, this is the time to get your best shot. Please get vaccinated. Risk levels are no longer the same for everyone. If you are not yet vaccinated, you are at greater risk for getting COVID-19, for transmitting it to people you care about, and to having a severe outcome or even to dying from COVID-19. Please take your best shot now. As we in Yukon face surges in the fall, we must act wisely. There will be times when we will need to alter our own behavior and protect ourselves and those who are vulnerable. But we must not be fearful, because we now have experience and understanding, and many of us are vaccinated. As we move forward, Yukoners will be guided by our recommendations, and the strict regulations that we have become accustomed to will be removed. In the event that we need such regulations, we will work together to bring them in as needed. But we will use this tool when we need it to reduce COVID's impacts. Some people may be preparing to throw off their public health protections, while others will hang on to their masks and follow the Safe Six, which have become so commonplace. There will be a place to use those tools to protect people who cannot be vaccinated, such as children under 12, and those who are more vulnerable to disease. It will still be important to stay home when sick and protect others, even for those who are vaccinated, and particularly when there is COVID throughout the community. With our understanding of how COVID spreads and how to be safe, these measures will continue to be used by many of us. Among those who are concerned, I recognize that many parents want to be sure to follow the key steps that they need to keep their children healthy while returning to school on Monday. I want to assure you that we have the proper measures in place to reduce the risk of possible spread and transmission within schools. These measures include the use of masks, which will be required for those 5 and older in communal spaces such as buses, hallways, lunchrooms, etc. Regular hand washing and use of hand sanitizer will be important and encouraged. Staff and students should monitor themselves for symptoms when leaving for school each day and stay home when they are not well. And of course, all who work or go to schools who are eligible for vaccination should become vaccinated if they have not already. I want to move a little bit toward what measures we have and how we are going to forge ahead together. We are well prepared to take this next step from pandemic toward endemic COVID-19. While the details are outlined in the principles and pillars of forging ahead, I want to focus on some specific measures here. Each pillar is important to and key to our path ahead, and I urge you to read the document in more detail. I've already discussed vaccination, and I want to emphasize that our work in partnership with communities and First Nations is so very critical. Our supporting of vulnerable people has been key to our response so far and will continue to be important. I know that some of you are particularly interested in testing. We continue to build on a robust and wise testing program with the aim of having the right test for the right person at the right time. We have several tools, including rapid testing in multiple settings and in our rapid response teams. We have lab-based testing in Whitehorse General Hospital, and we also have a key partnership with BC laboratories, including the BC Centre for Disease Control. We've also begun to use testing for screening in key settings and in hospitals, and this will remain important, particularly when there's significant transmission. Nevertheless, there are a few select places and situations where it's worthwhile, and at the same time, it's important not to overwhelm the system by mass screening, asymptomatic testing, and unnecessary use of testing. Therefore, our testing guidance carefully lays out when testing is needed. For the most part, it will still be business as usual. Get tested when you are sick or when you are asked to do so by a healthcare provider. I do anticipate there may be some changes in this, and will keep you updated as this shifts. Tested for COVID is very important during surge times, and those who are at risk, and for those who are at risk of severe disease, including those who are not yet vaccinated. It is also very important for those who are ill. At other times, it may become less important as COVID-19 becomes endemic. We will advise on the best approach at each point. Surveillance is something that is often misunderstood, and so I wanted to take a moment to talk about it today. I wanted to let you know that surveillance is all about situational awareness. It is the close monitoring of trends of COVID epidemiology at home, across the country, and internationally that contributes to our risk analysis and helps inform our next steps in the response. We will continue to conduct surveillance and to use this information to assess risks and inform our response. This is how we will know as things change, when we need to pivot, when we need to change and adapt, as we have done so many times in the past 17 months. This brings me to surge. As we have seen at several points here in the Yukon, there are times when we need to rapidly escalate our response. We need to increase our staff and teams in order to effectively respond and to minimize severe illness and death. We will maintain our surge capacity so that we can rapidly and effectively respond should things change. We have seen disease among our most vulnerable, and building their health and immunity and building supports is how we will work to prevent this in the future. Through social supports, treatment and healthcare, vaccination, we will build upon our strong people, build our populations stronger, and have a stronger, healthier Yukon. In closing, I ask all of you to be kind and considerate, to wisely use our knowledge and experience, to use the Safe Six and to respect other people using the Safe Six where it is necessary, to follow our guidance, and to walk bravely and wisely along this path together. Thank you. Shonitan. Gunonchish. Masicho. Merci.
Thank you, Premier Silver, and thank you, Dr. Elliott. We will now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start, and please also remember to mute and unmute yourself accordingly. We will now go to the reporters in the room. We'll start with Jackie from CBC.
Hello. The CDC in the U.S. recently warned of significant decline in vaccine effectiveness when it comes to preventing spread amongst older folks, particularly in nursing homes, and particularly in the face of Delta. I'm wondering if that's something that you're monitoring here, particularly given that older folks, seniors in the Yukon, were given priority for the first vaccines.
Thank you for the question. The question's related to boosters, booster doses of vaccine, so a third dose of vaccine in elderly populations, in light of potential waning immunity over time and the Delta variant. This is a question that is under examination by our National Advisory Committee on Immunization, NACI, and we expect an answer from them as soon as in a few weeks to a month, and we will act appropriately according to the recommendation of the National Advisory Committee on Immunization. We recognize this issue, and yes, we are monitoring it and following it closely. Thank you.
Thank you. Do you have another question, Jackie?
I do, yeah. You mentioned Ross River, and I know you spoke about it on the radio, but I was wondering if you could just talk a little bit more about the measures that are in place, any messages that you want to get out to folks in Ross River. We've also heard about some maybe elders getting sick or some medevacs. If you could just comment on the current situation there and the numbers.
So we have a number of active cases currently in Ross River. We have launched a rapid response team and had rapid testing on the ground there for 2 days, active on Wednesday and Thursday, as well as a vaccine clinic on Thursday. Our testing numbers were significant on the first day. On the second day, they were very low, meaning the percent positivity was very low, and therefore we chose to bring the testing back into the community health center with sample collection on site at that point. Now that we have more situational analysis in Ross River, we are working with Chief and Council on the next steps. I'm very pleased that Chief and Council are very active and are approaching this wisely. They have put their own measures in place and given appropriate advice to the population, and we continue to work on this and will respond. Thank you.
Thank you. As requested, we'll circle back to Vincent at the end. We'll now go to the reporters on the line. Nina with Canadian Press.
Hi, I was wondering if Dr. Elliott could tell me a little bit about, now that you've moved to the endemic stage, but you have the Delta variant in the community, what is your main concern right now?
So as we move out of pandemic toward endemic COVID-19, the things that concern me the most is the remaining population who are not yet fully vaccinated. That always will remain a risk, and that risk is solved by people who are eligible of becoming vaccinated. I'm confident that we have good situational awareness and capacity to respond, and that we have the appropriate tools to respond as we move forward. And I think if there was another concern, it is that people, as we come into the fall, as we open the schools and do the things that keep us healthy and safe, that people are wise, that the care continues to exist and the cohesiveness amongst us, and that we do not become fearful, but instead use the tools we have to walk bravely together. Thank you.
I would just add as well, we always balance between two different approaches here. One is, response to cases, outbreaks, as we saw earlier, but also, when asked what's our biggest concerns, all of that is outlined in our Forging Ahead document. The Chief Medical Office and their team have done an extraordinary job to prepare us for what we're entering into in the next few months. And the pillars outline not only concerns, but the conversations, the sweat equity that has been put in place over the last 17 months as we work as a community with public health. So our concerns are Pillar 1, First Nations and community partnerships. Pillar 2, vaccinations, and testing and surveillance. Pillar 3, surge capacity, as the doctor has mentioned. Those social supports for vulnerable people is Pillar 5, and the public health measures are outlined in Pillar 6. And I think that the team has done an extraordinary job in formulating this document to really give a notification to the public what our obligations and responsibilities are as we move into this endemic.
Mm-hmm. Thank you. Nina, do you have a second question?
I do. I was wondering if Dr. Elliott could tell me what the reproductive rate of the R is for the Delta variant, and how many people do you think are out there in Yukon who may not be tested because they don't really identify the symptoms now that the vaccination rate is so high? Because that's one of the problems with the Delta variant, that even when people are infected, they don't really know because they don't recognize the symptoms as much. Thank you.
Mm-hmm. I appreciate that there are people concerned about the Delta variant. I want you to know that we are monitoring this situation very closely. Delta is a variant that is more transmissible, and therefore the tools we have remain important, including vaccination, testing, and wise use of the Safe 6. We see that the Delta variant is the dominant variant now in our neighbors, and we expect to see more cases here in Yukon. This will not be a surprise when it happens. We are ready for the Delta variant. The Delta variant, although we have less room for error, we know that we have the tools in place in order to keep ourselves safe and healthy with this variant. And the people who are vulnerable to COVID-19, it remains the same group with the Delta variant. So first and foremost, those who are not yet vaccinated. And those who are vulnerable to severe outcomes are first and foremost those who are elderly, our elders, and our seniors. and we need to protect these people by ourselves becoming vaccinated, and also by being making wise decisions in terms of how we interact. The Delta is yet another challenge. I have to say that I will never forget the day that I stood before the people of Yukon and introduced the concept of COVID-19 being in Yukon, possibly, and how much uncertainty we had at that point. We are so beyond that now. We have so much experience. We have the knowledge. We have the partnerships. We are ready for the Delta. I also want to confirm that the 2 cases of the Delta variant have been contained, and we will continue to advise you if things change, but I will not be surprised to see more cases of the Delta variant. I will not be surprised to see potentially exposure announcements associated with various cases. And I think we have to use our tools and be wise as we step forward in this together. Thank you.
Thank you. We'll now move to Haley with Yukon News.
Thank you. My first question, I just want to clarify, with this document, the Forging Ahead document coming out, does that mean the plan is still to end the state of emergency on August 25th?
Yes. As the doctor has mentioned, our daily case counts have been decreasing. Our vaccination uptake rates are increasing. These are very positive signs. So as we mentioned, as we announced 3 weeks ago now, I guess, if these trends continue, we will be in a position to move on the state of emergency on August the 25th. The new document, Forging Ahead, will provide us the guidance as we do so. But regardless of whatever happens, and this is really important, we do remain very focused as a government to protect the health and safety of all Yukoners. And we have a number of tools that we'll continue to use to manage the pandemic, and we'll continue to actively manage the situation. A state of emergency can be lifted. We still have the Civil Emergency Measure Act in place on the shelf as a tool if necessary.
Thank you. Haley, do you have a second question?
I do, yes, thank you. My second question again for Premier Silver. Obviously the context right now is it's during an election, but earlier this week we saw the leader of the federal Liberal Party suggest that if his party was in power, that Canadians would need to be vaccinated in order to travel on planes and trains across Canada. I'm wondering if you have any concerns about that from a northern context where traveling on planes can be a necessity rather than a luxury.
I only have concerns where politicians don't take recommendations from public health. And in this case and situation, I'm not seeing that. So again, all decisions that are being made, and I got to give credit to, leadership right across the country. I think as a nation, we have been very sophisticated in political conversations, but at the same time, all of these things are based upon the best that the public health has to offer in terms of how we can protect our citizens. So as a Yukon government, that's what we'll continue to do. We continue to have excellent conversations with the federal government about vaccines, verification as well, the passport conversation. I know that there's an urging from the federal government to the provinces and territories to be as coordinated as possible when it comes to certification. We in Yukon and British Columbia lead the way in our digitization of our medical information, and those types of investments in public health from our government are extremely important as we grapple with and consider new federal regulations and regional guidelines to make sure that we keep everybody safe.
Thank you. We'll now move to Luke with CKRW.
No questions from me. Thank you.
Thanks, Luke. We will now move to John with CKRW.
Hi. I believe my question is for the Premier.
The Forging Ahead document says that YG will work to maintain capacity in the health and social services system in order to help respond with outbreaks where they occur. What does that include? Does that include the government hiring more doctors and nurses to help maintain surge capacity? Because a lot of facilities in the territory are already short-staffed as it is.
Staffing for medical professionals right across the country is not a new situation. Pre-COVID, during COVID, and into the endemic from the pandemic. Dr. Elliott outlined, we had some concerns in Ross River just last week and what we have the abilities and capacities to do. That's not going to waver as we move forward. People have been working extremely hard in the public health field for the last 17 months. I see it when I visit the communities. I see it when I see Togo and Balto and Team Fox, and just in the conversations we have with not only our public health officials, but our emergency measures folks, our communications teams. Everybody's been strained. Everybody's working extremely hard. The level of professionalism here in Yukon in all of those agencies and all of those departments is world class. We will always be struggling as a nation, to make sure that we have the amount of the proper amount of funding and the proper amount of doctors and nurses in positions. But I'm very confident in the teams that we have and the efforts that have been given to date.
Thank you. John, do you have a follow-up question?
Yes, I do. Thank you very much. I'm sorry, my notes are gone. Vaccine hesitancy is something that has been a bit of a topic in the past COVID-19 updates, and I'm wondering what steps is the government taking to help improve vaccination rates around the territory over the next few weeks? I know the state of emergency will be coming to an end on the 25th, but is there anything being done to, try and help people understand why the vaccine is something they should, receive?
That's a really good question. As a government, we've led Canada in our vaccination rates, in our ability to get out to communities, and we're grappling with what every jurisdiction is grappling with right now as far as hesitancy. And there's three distinct groups in there. There are people, a very small percentage of the population, who have preconditions, and I won't talk too much about that because I'm not a doctor, but there is a small percentage of people that can't get vaccinated. There's also groups of hesitants that can get vaccinated, and all of our thoughts and efforts are going towards identifying those folks and making sure that the vaccines are as available as possible. And the best way we can do that as a territorial government is to work with leadership in every single community. And when I say leadership in community, I don't necessarily just mean elected officials like chiefs and councils or mayors and councils. They've been doing impeccable work. They've been really helpful in disseminating false information, the snake oil salesmen on the internet, the alternatives to public health measures. They've been excellent in helping and asking the proper questions to the public health officials on our weekly updates with them. So those communications need to continue. We need to know what's going on in the communities. We also need to make sure that the vaccines are available when and where necessary, and that's what we've been considering and doing. But it is the stories of leaders in the communities. Sometimes there's trust issues with colonial governments. Sometimes that there's a need to hear from the leader of the family as opposed to the leader of the government. And how can we as a government make sure that we partner with all the leaders in the communities? As I say these things, the faces of all the great individuals, elders right across our territory who are going to be instrumental in helping, not the government, but helping our communities get vaccinated, helping our communities stay safe, and inform people with the best, most up-to-date information. If you have concerns about your own personal health, I know a lot of people have, allergies to certain things. I know people have preconditioned medical conditions. But have you had that conversation with a doctor about what that means for a vaccination? That's a really important conversation that every Yukoner has to ask themselves if they're still hesitant. So this is, again, part of the plan, forging ahead. It's working with partners. It's making sure that we utilize all of our resources in communications and public health, in our assets throughout all the communities to make sure that we can do everything we can to partner with amazing leaders in the communities and help, again, continue to lead Canada and the world in our vaccination rates.
Thank you. We'll now move to Chuck from Shone FM. Shone FM, are you with us? Okay, we'll circle back. Chuck Tobin with the Whitehorse Star.
Yes, good morning. I would just like to hear a little bit more about the boosters, Dr. Elliott. Are we going to move to a place where people will be getting boosters? And if so, how quickly? I mean, I believe the booster needs to be administered after 8 months after the last vaccination. When do you expect the boosters will be required, if they will be required?
Thank you for that question on boosters. So to be clear, a booster shot is a shot that a person receives after their initial series, so after they're fully vaccinated. In terms of the time period, it's the time period which may vary most certainly by population or by people's background between when we see the immunity decrease and a booster is appropriate. There is a lot of noise on this right now, and throughout the pandemic we've seen a lot of noise on things before the officials release the scientific statement based on an evidence review. The evidence review is currently underway, and we are awaiting with bated breath the evidence review by the National Immunization Evidence Review Body, who's called NACI. We look forward to that, and we will be administering boosters based on the scientific evidence that we should receive within a month or so. And we look forward to doing that and following the guidance. The expectation is that they will outline for which populations and at which time periods are most appropriate. Thank you.
Thank you. Chuck, do you have a follow-up question?
I do, but I lost it. So, yeah, I guess I'll leave it at that. Thank you very much.
Thank you. We'll now move to Julien Genac at CBC.
Hi there. I guess I just have one. Just want to backpedal to what the Premier said regarding disseminating false information and snake oil salesmen, etc. It's more of a clarification question. Did you suggest or say that community leaders are disseminating false information?
No, that's not what I said.
Thanks for that. And I guess the other question that I have is Dr. Catherine Elliott said or alluded to she said that there could be some surges in the fall, that the territory could face some surges. I'm wondering if those surges will include the Delta variant, if there are any projections for a Delta variant surge in the fall, and if so, where?
So if I had complete knowledge of what we have on the road ahead, I would be a different person and not a human person. Unfortunately, I don't have that. What we anticipate is based on what we know of importation risk. But also, I want to emphasize also that what is driving our epidemic currently is person-to-person transmission within Yukon, and that is what is keeping our case counts both stable and present. So I want to caution people from looking across the border all the time. It's something that was our biggest risk for a very long period, and shifting to the concept that it's person-to-person transmission within Yukon that's driving our epidemic is a change, and our case rates are currently stable. We do see a surge in a number of places. It does correspond with when the Delta variant is becoming the dominant variant. It also corresponds with the time when people have reduced public health measures, large gatherings have come on board, big football games, social events, etc. I think we have to be cautious with pointing everything to a single variant. However, we know the Delta variant is more transmissible, and I expect we will see the Delta variant here. Our goal as we move ahead is the health and well-being of all Yukoners and the prevention of severe illness and death. The way we prevent severe illness and death is by having people vaccinated, and I think that's a really important point here. We will see cases, we will see clusters, outbreaks, maybe even a surge in the fall, and we will move and adjust each step of the way in order to protect the health and well-being of Yukoners and in order to prevent severe illness and death. Thank you.
Thank you. We will now move to Vincent from Radio Canada.
Bonjour. Docteur Elliott, est-ce que je peux vous demander de résumer en français ce que change l'arrivée du variant Delta ici au Yukon, puis dans la suite de la réponse du gouvernement à la pandémie, s'il vous plaît?
So, Dr. Elliott, can you please repeat in French how the arrival of the Delta variant is changing our response to the pandemic at this point?
Ok, merci. Oui. La question, c'est si l'arrivée du Delta variant, est-ce que ça change notre réponse maintenant? On a anticipé qu'on va avoir des autres variants. Après le Delta, on verra presque sûrement des autres qui viennent avec des différentes caractéristiques. Nous avons anticipé ça quand on a donné les recommandations qui sont contribuées à ce document, le Forging Ahead. Et ce qui est dedans ne change pas avec le Delta. Alors, on a les mêmes outils qu'on a. On a les partenaires Premières Nations ici et puis aussi les partenaires communautaires. On utilise la vaccination qui est bon et offre la protection contre le variant Delta. On utilise les tests et les surveillances pour savoir notre situation et informer ce qu'on va faire à chaque tour à notre réponse. On est préparé d'augmenter notre outil, le test, la vaccination et même les staffs, les infirmières et tout ça. Et aussi, on utilise les supports sociaux pour ceux qui sont plus vulnérables aux choses sévères comme être à l'hôpital, même mourir. C'est les outils-là qu'on va utiliser contre le Delta. Et aussi, si on a besoin des régulations ou des plus fortes mesures, on va les utiliser. On fait toujours des assessments du risque et on répond en accordance avec l'évidence santé publique, scientifique et au contexte Yukon. Merci.
Thank you, merci. Do you have a follow-up question?
Monsieur le Premier ministre, une question sur les élections fédérales. Est-ce que je peux vous demander ce que vous en attendez et quels enjeux et quelles questions pour le Yukon vous aimeriez voir dans les plateformes, plus généralement ce qui peut concerner les Yukonais, que vous aimeriez voir abordé?
So, given that we have now the federal election, can we have a feeling of what is your expectations and what are the major questions that you will want the candidates to address during the election?
I think it's really important to follow a very similar modus operandi that we've had over the last 17 months. The federal government has been in constant communication with leadership, whether that be ministers, or premiers. We've said so many times that, Canadians might be done with COVID, but COVID's not done with us. And even though we're going from a pandemic to an endemic, there are some serious medical concerns as we move forward, especially as we look at two different considerations. Those who are vaccinated and the conditions, the symptoms of those individuals, and then those who are not. Also, as other variants are developed and as the science and technology develops, it's instrumental for any leadership out of Ottawa to understand the regional differences, the specific geographical differences right across the country, and the best way that they can do that is with constant communication with the leaders inside of those regions. So I implore all of the political parties that are vying for that job to including the current, if they are successful, review what we've done over the last 17 months. Keep doing what has worked, because I have, I've always been a federalist. I've always been extremely proud to be a Canadian. I'm very proud with every single region in Canada and their coordinated efforts with Ottawa as we grappled, as Dr. Elliott mentioned, from those earlier days where, the nation and individuals in the nation really didn't know a lot about COVID or how it was going to spread, and how we all just got together and really worked tirelessly to figure these things out, figure out supply chain management back in the early days for just masks, all the way through to working internationally as well. So it's extremely important for whoever wins this election federally to continue to commit to listening to the specifics of each region. Merci.
Thank you. That concludes our COVID-19 update for today. Thank you again to Premier Silver and Dr. Elliott. Thank you also to all the media on the line and in the room, and everyone who tuned in to watch live over Facebook. Stay safe, stay kind, and have an amazing Friday.